worry about this. It's just going to be 10 minutes or so. Okay. So I'm going to start the class now. I hope everyone is ready. Please keep your microphones off while I do the introduction. And I'm starting the class now. Here we go. 3, 2, 1, go. All right, so this is OET speaking. It's relationship building today, and we're going to basically be talking about what OET want from us when it comes to relationship building. So what we need to do in this class, it's the first class, is to understand what is relationship building. And you guys tell me, I know that you guys know, so you tell me exactly what is this in OET, okay? Then we're going to make a diagram of what OET are saying specifically about this. And finally, at the end, I always like to talk about most common mistakes. What do you need to avoid doing? What mistakes do students always make? Okay, so let's get started. I want to start with Kerim, or we could try Fuldem, Fumi, Francisco. Can you guys say hello?
Hello.
Hello, Fumi. So we're going to talk about relationship building. Okay, so can you tell me what is it? What is relationship building?
At the beginning, at the beginning, you make make someone to relax and.
Okay. At the beginning of the speaking,
yeah.
Trying to make someone relaxed. Okay. How are you doing that, Fumi? What are we doing here?
Introduce yourself.
It could be the way you introduce yourself. Noida, can you help us as well? It can be the way you introduce yourself. This is all good. What else are we doing to make people feel relaxed, I suppose?
Yeah, you maybe we can ask their names, or
this would be the introduction which we studied last week, so you could get names, etc. But what's something else we can do for relationship building, not the introduction? Do you know, Francisco?
To make a report.
Noida, pull them.
To make a report.
We say to build.
Build a report.
Now this is a French word.
Yeah.
So we say rapport.
Rapport.
The T is in French, as you know, very often they don't say the last words.
Yeah, with the rapport.
Like, do you know this word?
Projet, something like that.
Does anyone know this word? Marine, military. How do you say the second word, guys?
Military.
Military corps, right? Or Marine Corps. You see in Hollywood movies, Marine Corps is French. You don't say the PS. In the same way here, you don't say the T. Rapport, what does it mean, rapport, though? Carmen, what is a rapport? To build a rapport? Not an easy word, is it?
Trust.
Yeah,
Trust.
I'm not good in French.
Trust.
Make a connection.
Yeah, make
put trust, connection. Okay. This is all good. This is all good. What we're talking about for relationship building, I like this trust connection thing. Let's have connection. Okay. Make a connection. That's good. Who said that? Who said that?
I see it.
So Oiku, relationship means connection, right? And to build is to make. So this is a very simple way of thinking about it. We're making a connection with who?
Patient.
Patient, okay. Now, let me show you an example. Very simple example. In fact, well, yeah, I'll give you an example. I'm sorry to hear that. Fareed, what does this mean? I'm sorry to hear that.
This is empathy. It's showing empathy.
So empathy, guys, is empathy relationship building? Everyone.
One of the criteria.
Yes.
One of the ways. One of the ways. Probably one of the most important ways, actually. One of the most important ways would be to show some empathy. Okay, so what is relationship building? You're going to make a connection with the patient. Any way to do that is relationship building. Any way, okay? One way is empathy. But how many, I suppose, is a good question. How many ways, Shabnam, how many ways do OET identify to make a connection with the patient? Shabnam, do you know? Sumaya, do you know this? Karim, how many ways do OET identify? Nawida, someone who's saying
Four is maybe.
Okay.
There,
Carmen and
there is
Hussein, come on. Can we remember? Because you studied this before. Can you remember how many things OET say here? Carmen and
How
Four
many
and
criteria?
I can never
Five.
remember myself. Don't worry, I forget myself. Mame, how many ways do OET identify to make a connection?
The two ways.
Four.
I think it's more than two.
Yeah.
I think it's, guys, is there 3 or 4?
Four.
Four.
Four, Ellen. Four.
There are 4 ways. Okay. What is this, Manuela? What are we looking at here? What is this?
Is the criteria.
Yeah, and Manuela, we need to just check. What does that mean, criteria?
The way how they assess
The way they
or they score.
the way they score you, exactly. What is the top score? Karim, Nawida, what is best score in relationship building? You can see here, Karim,
Trust.
Kenny.
3.
What number? Number 3. Okay. So, guys, we have 4 ways. 1, 2, 3, 4 things you can do to make a connection with the patient. Okay. Now, what I want to do today is give you a chance to discuss these. Okay. Because this is not so clear. What do we call this kind of language, Carmen? What's the name of language like this? This language is...
Which one? Sorry.
This language you see here, it's not that easy, the language. It's a bit like, what do we call
Oh, academic, maybe?
complex?
Complex.
It's jargony.
Yeah. Indirect, maybe.
It's not very direct.
Yeah.
It's not clear. Okay. So today, what I always like to do the same thing, is let's make this more simple. Let's take this language and change it. Let's summarize it. I'm going to put you guys into groups. Okay. I want you to go into groups, read each one, try to say it in a more simple way. Because this is speaking. You don't have time to think about jargon and technical language. You need very simple things. Okay. So I'm going to give you guys just 5 minutes. Just 5 minutes. Go into groups, and I want you to discuss number 1, number 2, number 3, number 4. What do they really mean? What do they really mean? Okay, so rooms are opening now. Please join the rooms. I will share this screen. Try to say them in a more simple way. So we'll just simplify them. That's enough. Okay, so these guys are joining. Just 5 minutes, if you can join the groups, please, to have a bit of a chat. If you're watching on YouTube, this is what we do every day. We do 4 hours of live interactive classes just like this. And I'll give you a little bit more. I'll show you a few things when we come back, but I'm not going to show you the full class. This video will be only 10 more minutes.
Hi, Helen. Hi.
Hello.
Helen, please, can you join me to another room?
Yeah, is everything okay in that room, Kerem? Are people talking?
Yeah.
Okay, let me know if there's any problems. I'll put you into room 2, okay? Okay, can I ask you just to finish your discussions, come back, and we'll go through this one by one. All right. Okay, so guys, I hope you had a chance to have a chat. Obviously, we're all here trying to practice, and I hope you've had a good chance to discuss things. Some very experienced students in this school. What I want to do now is what I always do is just let's make this more simple. And then we can remember it, and then we can start trying to practice doing these things at the right time. Important thing is to do them not always, but at the right time. So let's get started. Ezra, could you say hello?
Hello.
So Ezra, this first one, A1, could you make that more simple for us? What does it mean? A1.
We can say my name is Dr. Esra. Thank you. Let me allow examination.
Well, I'm looking for in general, though. What does it mean, A1? Ezra, imagine you're talking to someone who doesn't know anything about OET. What does this mean, initiating the interaction appropriately? You gave me an example, but what is it?
I can give a very general example. OET type of medicine exam.
Right. Well, look, Ezra, do you think that A1 might be, is this true or not, introducing yourself? Is that correct?
Yes.
Exactly. Look, this is really simple. The way you introduce yourself, that is making a connection, of course. Did we study this last week?
Yes, first one.
We did. So actually, last week we studied this and we did 5 days of it. So I don't think we need to talk any more about introducing yourself. Okay. What about A2 though? Elif, A2, please. Demonstrating an attention. What does that mean?
It's like active listening.
Well, that would be one thing we could do. Okay. So what is active listening?
Like we don't interrupt the patient what they say.
Is that active listening, not interrupting?
No, no. We
So-
are listening. Yeah.
There's two things. So not interrupting. I agree though. That's good. What is active listening though? What do you say? What do you do?
We can do like like
Uh-huh. Mm-hmm. We can also do
Yeah.
something called echoing. Do you know what that is?
yeah.
What is echoing?
If patients say like I have a very bad headache, we can say I understand you experiencing a bad headache, like that.
Is that echoing, guys? To say
That's him.
I
No.
understand that? I don't. That's summarizing, right? Echoing is it's just when you say you repeat one word that they said. So you would say, uh-huh, headache. Right? So you don't need to say, I understand that. That would be more like summarizing, which is also very good. But that's not what we're talking about. What does it mean, though, A2? Aishat, can you give me a definition? Francisco. Demonstrating, Anna. What does that mean, demonstrating?
Showing.
Show. Show what? What are we showing?
Showing respect.
And we're also showing, what does attentive mean? Hussein, do you know attentive?
Carefully.
Carefully? Gloria, Fumi, what does attentive mean, this word, attentive? To be attentive. Show.
Pay attention.
Pay attention, right? Show
He
attention.
concentrates also.
There you go. So we need to show attention and show respect. We do this, I suppose, by I see. Or you can repeat one word, Headache. Uh-huh. Oh, I see. Painful, right? So these are some very simple things we can do. Is there anything else I can do to show attention and respect? Can you put your hands up, guys? Is there anything else? Normally I don't do too much of this. Yes, Fulden, what can I do?
I think asking permission.
Yeah, so let's put that in. Non-interrupting, ask permission. Can you give me an example?
For example, I would like to talk about your lifestyle.
Is that
okay?
Is that okay? So yeah, I would say little phrases to ask for permission is showing respect, definitely showing respect. Echoing is showing attention. Active listening is showing attention, right? I am paying attention. I don't think we need to, I think nurses and doctors usually understand this very well. Okay, let's look at A3. Francisco, tell me, what is A3? Adopting. What does that mean?
So adopting is kind of using non-judgmental approaches, like not judging the person or the habits of the person.
Let's just say not judging, exactly. So, but how do I not judge? It's a strange question, but how do you not? Do not what? What should
For
we?
instance, if a person says, I drink, I don't know, one bottle of wine every week, we can't judge about that.
Alcohol, yeah. Smoking, things like
Smoking,
that. Lifestyle, exactly. Good example. What else should we not judge, guys? What are we not judging?
Even religion in beliefs.
Religion?
In beliefs.
Belief.
I mean, different culture have different beliefs.
We should
appearance.
Appearance. So maybe they have lots of maybe different colored hair or earrings. So
Piercing.
What else? Piercings, did you say? Yeah, piercings.
I
Hair
think
piercing.
everything.
Sorry?
Everything we don't have. I think everything we don't have to judge.
I think you're right. Just trying to give some examples, but basically almost everything. You're not gonna say judgmental things about. I think probably also maybe a romantic lifestyle, for example. So how do I not do that though? We know we shouldn't, but what is the how can we, is this easy? Or is there
No,
it's not.
No, it's
an
not.
easy way to make a mistake?
With small words, we can hurt the patient. For us, it could be normal word, but for them,
Yes,
could
it's
be
about vocabulary, exactly.
Yeah.
Is that what you mean? Words and the way you phrase things.
phrase, especially if you don't know meaning of word. Sometimes I'm talking, I don't mean exactly that thing, but it sounds like different way to person. It's about
exactly. Go on.
It's about kind of being more natural. No more natural phrase.
Yes, and this week, Shabnam, guys, this week when we're practicing in groups, we'll try to focus on this. You cannot know every single thing, but I think the best advice in general is, look, be general and indirect on these topics. Okay, giving advice is sometimes difficult as well, isn't it? Be general, be non-direct. Okay, we'll talk about this more tomorrow. I think we all know not to judge. What does judge mean? Can anyone tell me? What does it mean to judge?
You are guilty. You are wrong.
Criticize someone.
Yeah, criticize, right? Guys, do not criticize. To say you are guilty, to say you are wrong. Exactly. Okay. All right. Last one is the most important one, and we're going to focus on this one more than the other ones.
Empathy.
It is quite simply empathy. Empathy. One word. Okay, maybe we can say show empathy. But what is empathy? What is empathy? Chithra, can you tell us? Carmen, Yunus, what exactly am I doing when I show empathy?
Can be mercy.
What you feel.
You feel what? You feel
sorry.
You feel sorry. Yeah, can anyone help? What do you
I feel your pain.
feel? There.
Provide
I
for
were you.
assistance.
Someone said, I feel your pain. Who said that?
Yeah.
So you feel their pain. You're kind of
putting in their position.
Put yourself in their shoes, put yourself in their position. Okay, so this one is very, very important because I think we have to use it a lot. Okay, so I want to talk now in more detail about empathy.